Hello, I'm Dr. Anand M, Senior Consultant in Urology, Manipal Hospital, Malleshwaram. This is regarding the latest advancements in benign prostate surgery. Now, over the years, TURP has been roosting the place for the last 80 years, and obviously, every procedure that is coming in new is compared to the standard, what is called a gold standard procedure, transurethral resection. But as we all know, there are a lot of risks involved in transurethral prostate resection because of the notorious TURP syndrome, because of the extensive bleeding that can happen in a vascular prostate, and that you're limited by the size of the prostate, in spite of you being technically a very good surgeon. Large prostates always are a hindrance to transurethral resection. And then, now you have bipolar prostate surgery that is being done. But in the earlier, it was quite a big confusion when a lot of people had pacemakers inside them. And therefore, the new procedures, lots of them have been trying lasers, different kinds of lasers, and plasmatic kinetic resection, cryotherapy, radiation therapy, whole lot of things have tried. But eventually, as of now, in my opinion, it's the laser which has emerged. And the paradigm in this surgery is the Holmium laser. Now, what is the advantage of this Holmium laser over the conventional transurethral prostate resection? Number one, there is no such problems as fluid absorption, no TUR syndrome, which as doctors you would all know. The second advantage is there's hardly any bleeding. You don't even need to go off blood thinners or antiplatelet drugs that these comorbidities have inflicted upon the patients. We can boldly go and do the surgery without much of bleeding, with the advantage of Holmium laser. The third advantage I would say is the size has nothing to do with you can go on operating however big it is, because as I said, there's no absorption of fluid. It lasts pretty long, and even if it takes a little long, it's a safe procedure. And if somebody is on a pacemaker, there's no interference with the pacemaker. We're not using electricity here. We're using a laser fiber. That is the advantage of this prostate surgery. Now, compared to the other prostate surgery, what is the difference? Earlier, it is easy for the prostate surgery. A lot of people even now do it, what is known as visual laser ablation. One of the commonest surgeries that was done was KTP or PVP surgery that was being done. The disadvantage here was you had to use a very expensive fiber which could be used only once. You had to wear goggles, the whole place would be colored up with the laser color of green light, and then you would ablate the surgery. Again, you had a limit in size. Unlike what I'm talking about, Holmium laser, the size was always limited when you did the kind of surgery with the PVP. So slowly it is not being very popular, though technically it was very easy to master and learn, especially for a person who knew how to do a transurethral resection or a TURP. It was very easy to do this surgery. Then the other disadvantage was you have ablated the tissue, so you don't have nothing for histopathology. And as I said, 5 to 7% of an apparently benign prostate could still be harboring malignancy, which could have been a missed malignancy. And therefore, a CA prostate could easily be missed with ablation. That is the disadvantage of the ablative kind of laser surgery. Then, of course, enucleation. Enucleation is what has been tried with other kinds of lasers, but the best enucleation which is now happening is with the Holmium laser, which is there for at least 20 years now. More and more people are learning how to do it, and that is really working well. Of course, the new other laser which has come is the Holmium laser. Holmium laser is also equally good, but still it has very short experience in terms of maybe being around for prostate surgery for about 5 to 6 years. There are other kinds of procedures available, what is called Urolift, where they open up the prostate procedure by using an instrument. They have injection of alcohol, they have cryotherapy, a whole lot of things. But as of now, results are not really convincing. The only procedure which is really convincing and probably now stands ahead of the transurethral resection is the holmium laser of enucleation. Now believe me, with the holmium laser enucleation, you are achieving two things. The best removal of the adenoma, which was achieved actually in the open surgery, and the endoscopic advantage of the transurethral resection. A combination of both these two are helped while doing the holmium laser surgery. That is the advantage, and that I believe in the years to come is going to last much longer and going to be more popular. What is making it yet to pick up amongst every hospital, among every urologist to love this procedure? The main problem here is that learning is very, very difficult. You need to have a mentor to see the surgery being done by you. Technically, to learn the technique of holmium laser is not an easy job. In fact, when you start learning the procedure, sometimes it's a tear-jerking situation. And you always need a mentor to make sure you don't get into trouble, neither you nor the patient. So the learning curve is rather steep, unlike that you take for the transurethral resection. Like we said, everything has a dark side too. Holmium laser surgery is a fantastic procedure that I keep talking about because I'm into it. I've been doing it for a long time and mastered the technique, so I'm very happy doing it. But it's not as if, everything is hunk and dory. You can have bad situations there too. Now, most of the bad situations that happen with the holmium laser surgery is you could have a lot of post-operative issues. Now, remember, the entire prostate the inner part of the prostate is removed. Unlike in a TURP, the entire adenoma comes out. So you're going to have an overactive bladder situation where a couple of times patient finds it a little difficult to get control on his urine for some time. So one of the disadvantages of holmium laser surgery is they will have, most of them initially, and you need to convince the patient that it's going to happen to you, but by the end of 3 to 4 weeks, you will be a happy man. What is going to happen is they will usually end up having what is known as a stress incontinence. That every time they get up, sit down, cough, laugh, or even sneeze, a little bit of urine drops out. So as long as a patient has been cautioned about it and warned, they will recover very fast. This is one of the disadvantages that you need to tell them about. The other disadvantage is, it is in the present situation in our country, a little bit of an expensive surgery compared to the conventional TURP. So, because the laser instrument itself costs a lot, the fiber costs right of much, and so therefore, one of the disadvantages is the charges, the cost that may affect the patient, especially in a lower socioeconomic hospital. The other disadvantage of prostate surgery is incontinence. Now, one good advantage is, unlike transurethral resection, the true incontinence hardly ever happens with the prostate, because the surgery is done from the control mechanism, that is the external sphincter, towards the bladder neck. So once you always cross the Lakshman Rekha, what we call, and then we start doing the surgery, chances of true incontinence is very rare. But like in TURP, like in any other prostate surgery, incontinence can happen. And if there is true incontinence, it's rather difficult to manage post-operatively.